We're back with Cone Health's Dr. Laura Murray. She's answering all your questions about COVID-19. Before the break, someone messaged in wanting to know what is the best kind of mask to stop the spread of COVID?
Well, that's a great question. So I think that the gold standard is an N95, and these are also, in some situations, probably overkill and very uncomfortable and hard to find. And so I think that we all know from earlier in the pandemic that a well-fitting surgical mask plus eye protection plus distancing is exceptionally effective in preventing COVID. And so I think with keeping that in mind, that almost all situations will respond to a well-fitting surgical mask and distancing.
I think you just touched on something that doesn't get nearly enough attention, eye protection. Why is that so important?
Well, it turns out that respiratory viruses can enter your body through your eyes, right? Your eyes are mucous membranes, and so that's a fertile landing ground for respiratory germs. And so, this has actually been true all along, and we weren't paying maybe enough attention to it because this is also how colds and flu can get in. But one way to protect yourself is to keep your eyes covered, and so that is absolutely something that we are leveraging for COVID.
So are like your glasses that you're wearing now enough, or do you need the side pieces too?
If I was going to be face-to-face with somebody who had COVID, I would really want a face shield or goggles.
What about on a plane? Do I really need to go to that extent in public places?
I think did you say in a plane, like
yes,
an airplane?
ma'am, yeah.
Yes. Okay, so it's a little bit of a crapshoot who you're going to sit next to. And so I would say in that situation where you might be really close to somebody with unknown exposure potential, that might be worth it. It just, it depends a little bit on how much risk taking you feel comfortable with, because you don't have a lot of control over your seatmate.
So many people have already gotten COVID and they feel like they're in the clear. Can they get it again, and can it be worse the second time?
Absolutely, that can be true. We have begun to accumulate experience that people can get COVID more than once. I think it depends on the individual situation when you acquire a second infection, whether you could get sicker or not. It depends a little bit on how much germ you breathe in and whether your immune system is as functional as we'd like it to be. Has there been anything new that happened health-wise that might cause you to be at increased risk of severe infection? So I think that you can't rule out that it could be worse another time, and absolutely people can get it again in the same way that people get flu again, and it's a little unpredictable.
We've also had a question about your hospitalization numbers that you put out. If someone maybe has a broken arm and while they're there they test positive, is that counted in the hospitalization number, or is it only the people who are really sick with COVID?
I think that when people come to a hospitalization for another reason and test positive, we have to label it appropriately and let the data scientists sort of sort out how that's being counted on the regional and national levels. As far as Cone Health goes, they're tracking, people who come into the hospital and are diagnosed immediately, and that seems to be their primary diagnosis, and people who seem to have acquired it later on.
How are we doing on resources right now? Is our ICU looking okay?
I think that we've got the staff that we need to take care of folks. It is certainly a different landscape than it was a year ago, even when we weren't seeing quite the same impact from people being out sick with COVID or people being impacted by economic factors such as childcare or schools, and so having to maybe rearrange what they're doing in life because of other factors. So I do think that the staff shortages are real for every industry and certainly for healthcare, and we are staffed to take care of things.
Well, thank you so much for all of your time. Some really good advice. One of the most interesting tips here was definitely the eyewear. We all should think about that and look at options for protecting ourselves. All of this will be up online if you need it. All you have to do is head over to WFMYnews2.com and it'll be right there in the 2 Wants to Know section. Always great advice to share with your friends and family to make sure they know what they need to know to stay safe too.